Good evening, all the viewers. On behalf of Macleoids, we welcome all the viewers on this panel discussion on unlocking immunity with nutrition. We are fortunate that we have a very great personality, Dr. A. Muruganathan, who's going to moderate the session today, and along with the eminent panelists. Dr. A. Muruganathan, many of you are aware of him, and he's a well-known physician across the country. And the most important thing is he is a people person. He is a emeritus professor of the Tamil Nadu Dr. MGR Medical University. He is governor of American College of Physicians India chapter, is the dean of Indian College of Physicians in 2016-17, and president of Hypertension Society of India 2015-16. Was also past president of Association of Physicians of India API 2013-14, and past president of Tamil Nadu IMA and past dean of IMA CGP as well. Is the editor of Adult Immunization 2014, Progress in Medicine 2017, and Medicine Update 2013 and 2017. And also a Manual of Hypertension in 2015 and 2019. He has received many awards. To highlight the few, he has received a BC Roy Award from the President of India in 2005. He has received Best Performing Doctor Award from Tamil Nadu Government on Doctors Day 2014, and he has received the Lifetime Achievements Award by Tamil Nadu Dr. MGR Medical University, Savita Medical University, KG Foundation, and from Dr. Mohan's Diabetes Foundation. So I welcome Dr. Muruganathan and hand over the session to Dr. Muruganathan for further proceedings. Over to you, Dr. Muruganathan.
Thank you for that nice introduction. My dear brothers and sisters, I am very, very happy and pleased to welcome all of you for a very interesting and an important webinar brought to you by American College of Physicians India chapter, supported by Macleods and promoted by Exchange webinar.
Sir, you need to start your video, sir. Video. Your camera. You need to start your camera.
Camera put it. Yeah. That's some. Okay. So let me have the pleasure of introducing our eminent panelist. Dr. Mangesh Tivaskar is a consultant physician and diabetologist, Shilpa Medical Research Center, Mumbai. He is a gold medalist in medicine. He is Honorary General Secretary, National API, ICP and PRF, on editorial board of JOPI, Medicine Update, IJD, governing body of West Zone Representative ACP, guest editor in Satellite Journal, World Journal of Anemia, delivered more than 1,000 lectures at national and international conferences, and has multiple chapters, publication, posters, presentation, write-ups in textbook, peer-reviewed journalists, and international platforms. More than all these things, he is a very shrewd academician and a good clinician. Next, let me have the pleasure of introducing Dr. Sangram Bidar. He is the Professor, Department of Medicine, MR Medical College, Gulbarga, Karnataka. He has got awards from FICP from Indian College of Physicians, FACP from American College of Physicians, FRCP of Royal College, Glasgow, then also FACC, FSCC, FEAC, and FRCP, Ireland. Publication done in national and international journals. Is an associate editor, journal and area of interest, cardiodiabetology, life member of international ACC, ADA, and national API and state API CSI. Both Mangesh Tivaskar and Sangram Bidar are our beloved members of American College of Physicians India chapter. Even Anupam Prakash is a member of our fellow of American College of Physicians. He is the professor of medicine, HOD in Lady Harding Medical College and Association Hospital, Delhi. Editor-in-Chief, Indian Journal of Medical Specialties. Associate Editor, APA Textbook of Medicine. He has got 252 publications in journal and books. Delivered 144 lectures and 22 paper presentations. Principal investigator of 12 phase 3 international trials, guided by 8 STS and 15 PG theses, awards DST Award as a young researcher to meet Nobel laureate in Germany, LHMC Oration, GS Sayani Oration, Srimati Pavan Kumari Jain Oration, President of Delhi Diabetic Forum, Vice Chairman Association of Physicians of India, Delhi Chapter, Member of Governing Body of Association of Physicians of India, and Member of Faculty Council, Association of Physicians of India, 2016 to 19.
Thank you,
Now,
sir.
this Madam Shilpa Joshi, a dynamic lady, a director of Mumbai Diet and Healthcare Center, practicing dietitian, diabetes educator, vice president, Indian Dietetic Association, honorary secretary, All India Association of Advancing Research in Obesity, master trainer, diabetes conversation maps, course director, National Diabetic Educators Program, trained more than 3,000 diabetes educators, presented at various national and international meetings, including ADA, International Diabetic Federation, and International Confederation of Dietitians. Runners-up, recipient of Wim Gummers International Essay Award of the Academy of Nutrition and Dietetic Foundation on malnutrition. So every day, let me go to the topic as such. Every day we have preventive measures. What is the preventive measures? Such as hand washing, avoiding contact with sick individuals, and good hygiene. It can go a long way in reducing risk of viruses, bacteria, and other pathogens. But in addition, however, there is evidence that nutrition and other lifestyle measures influence immune strength and susceptibility to infectious disease. That is why today we have chosen the topic of unlocking immunity with nutrition. Whether these measures do or do not influence susceptibility to COVID-19 or its clinical course is not yet known, but definitely all of you should follow the strict instructions by hand washing, sanitizing, then mask, and then physical distancing. That is very, very important. Apart from the adding immunity with the help of nutrition. More than 2,500 years ago, Hippocrates said, "Let food be thy medicine and medicine be thy food." Even now, it holds good. So your medicine has got, so your food has got so many medicines which help to fight your disease, and it improves the immunity. I am loving it era of McDonaldization, because everybody now interested in fast food. I always say fast food takes you faster to the grave. Okay, what nutrition support the immune system cells? Research over the past 10 years has shown nutrition plays a major role in supporting the production and action of both the cells and the soluble factors of the immune system. Protein, antioxidants, essential fatty acids, and certain vitamins and minerals are the key to a healthy immune system. Today, COVID-19 pandemic has put everyone at risk. No one is safe until all of us are safe. That is the mantra today. Nutrition is critical more than ever now. COVID era demands optimal immunity. COVID-19 has put a spotlight on the important role nutrition has in the immune system. The important key factors are eat right, hydrate well, regular exercise, minimum salt, minimum sugar, minimum oil, 8 hours of sleep, right supplements for optimal immunity. Of course, good sleep helps in hormonal balance, reduces inflammation, decreases lifestyle disease risk in both adults and children. It boosts your immunity. In fact, there is a paper during the Ebola pandemic. They found out the sleep, especially early hour sleep between 10 p.m. to 11 p.m., that produces growth hormone that stimulates IL-12, which helps in the immunity. So if you want to sleep well, at least 7 to 8 hours sleep, go to bed early. Between 10 p.m. to 11 p.m., if you have a good sleep, that really stimulates growth hormone, that stimulates IL-12, and that is good for immunity. So that is a message. So those of you who are, in the hard curry, worry, please take your sleep, and sleep is very good for immunity. And then now, all our panelists are eagerly waiting to answer many questions. So let us first start with Madam Shilpa Joshi. Is the RDA of nutrition sufficient for optimal immunity? we are having recommended dietary allowance in many nutrients. Is it sufficient, madam? What is your opinion?
So RDA is the amount of it's the daily intake which is sufficient to meet nutrient demands in about 98% of population. There is an estimated average requirement, that is EAR as it is called as, is an average intake which is enough to meet requirement for 50% of population. Now, after saying that, there are two kinds of nutrients. There is macronutrients and micronutrients. If the newer RDAs, yes, I was just going to say, I was just published day before yesterday, last week, I think, last Wednesday probably, and there we have seen that the levels are quite high. The requirement of RDA, if you see macronutrients, among them protein requirement is 45.7 for women and 54 for men. This is presuming that the weight of men is 60 kilos and that of women is 55 kilos. Now the point is, this is all in terms of the weight of the person. Increasingly, we are finding Indians weigh much more than 55 and 60 kgs, and therefore always RDAs are not sufficient to meet the requirements. And lot of times, especially in micronutrients and certain nutrients like proteins among macronutrients, you have to supplement the nutrition beyond what is recommended in RDAs, because RDAs are for lower weight individuals. Especially, more specifically in this audience, I would like to say is protein intake, which is again, if you look at RDAs, it's in around 45 to 50 grams. We require about a gram per kg body weight of protein, especially during pandemic times. And considering that, we are seeing that individuals with diabetes don't do well with COVID at all. So if you want to maintain your blood sugars, you need much higher amount of protein. Also micronutrients, especially zinc, vitamin B12, vitamin D, have to be supplemented enough to meet the requirement, because most of the Indians are vegetarian. We do not meet requirement of fat soluble vitamins. And those who eat non-veg, I would like to emphasize this point, they eat it in a very overcooked form where most of the vitamins are actually not available for absorption. So therefore, RDAs in certain amounts like fats or carbohydrates are enough, but in certain nutrients like vitamins, certain kind of specific minerals which are associated with immunity and proteins, you need much beyond RDA.
Thank you, madam, for that excellent answer. What is the specific, Anupam, what is the specific role of soy proteins in boosting immunity? Soy proteins.
Sir, when we talk of proteins and nutrition, it is important. We are talking in the context of immunity, and the COVID times, we do need to boost our immunity. And if we remember our school days when we were taught about the basics, so proteins have an inherent concept of, number one, they are required for growth of the body, repair of the body, and number two, for enhancing the immunity. So there is no doubt about the proteins enhancing immunity in ourselves. So especially in COVID time, that is very pertinent when we know that there is no sure shot medicine or vaccine right now with us. So it is important that our immune system fights the infection, whether it is viral or any other infection. It is very important. The other thing that you said about soy proteins. So as doctor, it is a pleasure to speak after Dr. Shilpa Joshi, although she is the most qualified person in the panel to discuss about diet. But yes, I would just add to whatever she said, because she has rightly said, the world actually is moving towards from non-vegetarianism to vegetarianism. And now with that focus, as she already said, that non-vegetarian items, they lose a lot of their antioxidant properties because of the vitamin, the more overcooked non-vegetarian items that we relish with all those fats, etc. So the problem is that with us moving towards vegetarianism and encouraging, Dr. Bhagnathan himself is a stalwart and pro for veganism and vegetarianism. So I would say, with that thing in mind, it is important for all of us to understand that in the vegetarian items, soy proteins through the years, over the years, have stood the test of time. They are considered to be complete proteins in a sense, and they give you a lot of amino acid variety, and lot of one-to-one uh, the ratio that is there, that also they give exactly their digestibility corrected amino acid score also. They also have a great ratio of that. So that is always better, and they have a whole lot of probably all the essential amino acids, the semi-essential amino acids, and other amino acids that we get from soy protein. So whether we have as in our daily diet, because at times it is not important, not very easy to have soy proteins everywhere in our diet. But yes, we can incorporate them in soy milk. We have items which are there. We can have nutritional supplements which are soya rich, which is very important. And these contain not only these supplements actually have bioactive peptides. So they have peptides which are actually in the same concentration which are required and proven to be immune boosting properties. So we can have all these things, and soya proteins obviously have stood the test of time, and they're important. So this is just another slide. You can see this was a study which the slide shows, and they have immune modulating effect. The soya proteins, this study was in healthy volunteers, and they gave soya proteins, and those who had lymphocytes as well as granulocytosis and lymphocytosis. So there was immune modulating property which was seen by giving 100 gram of soya proteins over a fasting state, and then they could see that granulocytosis reduced a little. Lymphocytosis also in those patients who had lymphocytosis, that also reduced. So soya protein has been shown to have an immune modulating effect, which is actually very interesting. And this is not a very recent study, but an old study. But yes, this does give credence to the fact that yes, soya protein is good for health and can actually modulate the immune system towards the better. So there are a number of other papers also, but I think for paucity of time, I will not go into that. But yes, in fact, there was this study also looked into the CD3, 4, CD11B, etc. And although major of the CD population, CD cell count was not different, but as CD11B plus and CD56, they did improve in the healthy volunteers. So this is in a healthy volunteer study, but yes, we can look forward to soya protein boosting immunity even in the diseased or healthy adults, and probably they will have some effect in boosting immunity in the COVID epidemic also, pandemic also.
Yeah, thank you, Anupam. In fact, somebody who's they have lactose intolerance, the soya containing milk and all are very good, because lactose intolerance people, they cannot take milk protein. So this also adds to the people's intolerance. This is a better option. Coming to Mangesh, what is the specific role of whey proteins in boosting immunity?
Yeah, thank you. Good afternoon, sir, and good afternoon, everybody. My fellow panelists, thank you for that question. Sir, as Dr. Anupam has very rightly pointed out, and even Shilpa has also very specifically suggested that we are moving from non-vegetarianism to vegetarianism, and there are distinct advantages of that. But then the question was always asked, will vegetarian diet would be able to supplement that necessary protein daily requisite? And probably, as soy protein is one of the richest source of, I would say, not first class proteins, but definitely utilizable proteins. Whey proteins also have a direct role as far as immunity is concerned. And apart from that, it has got a wonderful role in the muscle health. Right? It contains beta lactoglobulins. We all know about that whey proteins primarily are the proteins which give you more of beta lactoglobulins, which are concentrated in muscle, and they basically will increase means not only the size but also the number of the myofibers. And that is one big area where probably especially in these COVID times, apart from immunity modulation, people, they lose a lot of muscle mass primarily because of either because of the drugs like steroids, which can cause steroid induced myopathy, or because of the lying down, you can lose muscle mass very fast. So then probably supplementation with whey proteins definitely will help. But apart from that, whey proteins also offer you some immunoglobulin. So probably some passive immunity in form of either bovine serum albumin or immunoglobulin can be also given. And we all know that apart from the muscle building capabilities, beta lactoglobulin has got a very, very specific role of the regulation of the white blood cells. They are responsible directly to stimulate splenocytes, if you can see, and splenocytes are responsible for not only I would say removal of the dead tissues, because we know, if you will be surprised to know that number of red cells and white cells that we produce are significant. Every day we produce around 370 billion white cells in 24 hours. So considering this whole immune system work, there is a lot of debris which is created, which needs to be cleared off, and probably splenocytes, they play a huge role. Apart from that, beta lactoglobins have what a tremendous role to play in increasing glutathions, which are extremely important for not only the boosting up of immunities, but also they have got a role to play as far as restoring of our microgut flora, which is extremely important as far as immunity is concerned, because these are all the first line defenses. Apart from that, lactoferrins, we all know that they have some anti-inflammatory effects, and they inhibit TNF alphas and interleukin 1 and interleukin 6 to a certain extent. And also they improve some kind of a cellular immunity. So they'll have a boosting effect on the CD helper 4 cells, and also will stimulate and increase the manufacture of CD8 or natural killer cells, or what we call it as antigen presenting cells. And also that immunoglobulins which are present, apart from giving glutathions, really will be important for activation of complement factors. And these are complement factors and major histocompatibility antigens are directly responsible for the antigen recognition process. Now you'll be surprised again to know, if I tell you the figure, how many antigens our white blood cells can recognize. I'm sure the figure that I'm going to show and tell you are going to blow your minds away. Our human body can recognize more than 1,000 trillion antigens. And these are all done by with the work of the CD4, antigen presenting cells, complement factors, and of course the major histocompatibility complexes. So all these things are definitely boosted up by whey proteins. And also you can see that whey protein have some antiviral activities. They are here almost on the slide. There are almost nearly 15 viruses where they have been shown to have an antiviral activity. Over to you, sir.
Thank you, Mangesh, for that. The whey proteins are helpful in the muscle production. Especially it is true in the elderly person when he has growing old, his muscle is weak, and you do need a protein to strengthen his muscles. I think whey protein is one which can do that. Sangram, what is the role of colostrum as an immune enhancing agent? Colostrum.
Yeah, colostrum is basically one of the important factors for it's loaded with immune, basically growth and tissue repair factors, and the most potent natural immune booster it is called as, and the source of immune components and nutrients, and contains more proteins and immunoglobulins, vitamins, minerals, etc. than the milk. And it is got a protector against a wide spectrum of bacteria and viruses, a natural protective mechanism. The studies have shown that colostrum is the only natural source of two major growth factors, transforming growth factors like alpha and the beta, and the insulin-like growth factors 1 and 2, which will be helping. The other cellular contents of colostrum being the cell types, and mainly the macrophages, which contains of 286 plus or 116, the polymorphs, the lymphocytes, the epithelial cells. So these are some of the important factors where colostrum plays an important role in protecting boosting the immunity and taking care of the natural source of major growth factors, like transforming the growth factors like alpha and the beta cells. So that is how it plays an important, like it is called as an immune booster. So that's why we prefer all patients, those who are basically admitted in the intensive care, where these boosters, immune boosters, are required mainly for the patients who are chronic debilitating, like ICU patients, chronic patients. Nowadays we are seeing so many patients with normal persons, so many doctors, like they're not much immune compromised, but still we are getting the COVID diseases. But basically those who are staying in ICU for quite long time, they require all these nutrient supplement, protein supplement for all the chronic patients, chronic debilitating patients, those who are on ventilators, those who are on high flow nasal oxygen, mainly for the admission patients and the ICU setup. But hardly we use in the outpatient because they're all quite healthy until unless a patient is of low socioeconomic, we come across. That's a take on the colostrum on the COVID
And
patient.
also it helps Sangram in prevention of viral diseases like flu and respiratory infections.
Yeah, yeah,
So now
yes.
And
I'll come to
and
the
sir, also colostrum
yeah
is full of IgA, and
yes
Yeah,
which is responsible for directly not only offering the immunity to a newborn, but also boosts up the uh, I would say a healthy multiplication of the gut flora, which is extremely important. So they are present in milk, they are present in tears, they are present in the saliva. So they are like gatekeepers of our system.
yeah.
yeah right. I think we heard from all our panelists. Now let me come to Shilpa, a dietitian who's dealing many of these cases. What do you think, Shilpa, the role of proteins in enhancing immunity?
So, I mean, all the speakers before me, Dr. Tivaskar, Dr. Anupam, Dr. Sangram, everybody has been speaking about various facets of protein. So maybe soya protein is one kind, whey protein is another, and colostrum is third. So they have all kinds. Protein has huge amount of effect. Besides immunity, also like it is shown that they increase muscle strength. They are hypolipidemic. They, especially management of blood glucoses, they're important. They're very important in wound healing, cholesterol lowering, anti-hypertensive, antimicrobial, as it is shown as, and they promote growth. And hence, proteins become very, very important in immunity because most of our immune cells, whether it's white blood cells, so whether it's cell-mediated immunity, whether it's humoral immunity, like Dr. Tivaskar said, whether it is the complement system, which is the soluble proteins, the whole immunity is based on, use of protein in a specific way. Antibodies are also proteins which are folded in a certain way. And we know that proteins, what we produce in our body, essentially we are dependent on diet, especially for the essential amino acid intake. And unless we are getting essential amino acids from the food, we will not be able to meet the requirement, especially in today's time when our protein requirements are higher, because like Dr. Tivaskar very interestingly said that we produce 370 billion WBCs every day. How are we going to produce without essential amino acids coming from the diet? And these essential amino acids essentially come from proteins like soy, like whey, or even maybe colostrum. So any protein which is complete in nature, or like they said, first class protein, which has a very varied amino acid profile, is what we require for immunity.
Okay, thank you, Shilpa. Now I'll go to Anupam. What is the role of dietary supplemental proteins in antibody production?
Well, sir, thank you. It is very important that, as Dr. Sherpa said, that yes, we need to boost immunity by taking adequate proteins. And if we are not taking adequate proteins, as she said, that RDAs just meet the minimum requirements. So we need to supplement over and above. And for that, at times, we need to extra nutrition or maybe supplements also. So with that thing in mind, I think we should, when we talk of defense mechanisms and immunity also, as Dr. Shilpa and Dr. Mangesh were saying, white blood cells also. So now there is a definite role of proteins and high biological value proteins. They are crucial for optimal defense of the body. And it has been seen and unequivocally proved also that yes, that amino acids which are present and all those essential and semi-essential amino acids, they have a role in not only the activation, there are different pathways of the antibody production. We have the B cells and T cells, the lymphocytes which are there. Then we have the monocyte macrophage system also, and they produce a lot many chemokines or cytokines or monokines also. So there are different parts of antibodies production. So in the humoral system, we have the B lymphocytes and the antigens, and yes, it has been shown that yes, amino acids are required for the production, as Dr. Shilpa was saying. So it is important that we have all types of amino acids, good quality protein, whether it is soy, whey, or at times colostrum. So that colostrum cannot be had apart from that is the first milk that the mother produces soon after birth. So that is not there. So we have to take it from animals or we have to preserve it. So in those conditions, we need to have it as a supplement. So these things actually supplemental proteins do provide us good amount of antibody production if we have a good quantity, 1 gram per kg, as Dr. Shilpa said. So that is the requirement that we have. That is the minimum requirement that we should take daily, and we should essentially see that we have that. So not only for B lymphocytes and antibody production, but yes, the cellular immunity, the T lymphocyte driven immunity, that has also been shown to be affected by the protein intake. So once you take good quality and adequate protein, so T lymphocytes, B lymphocytes, there is optimum functioning, plus the expression of the lymphocytes. So lymphocytes also, apart from lymphocytes, we then have the chemokines. Now these chemical mediators are also proteins and protein products. So they will be deficient if we are not taking adequate proteins. So that is the importance. So whatever interleukin production, the macrophage activation, all these processes by and large are protein mediated, and that is why it is important that we need to take adequate quantity of proteins. And proteins do have a very important role. As I started, even a 6th, 7th, 8th class student is also told that you need to have proteins to fight strength, whether it is muscle endurance or whether it is humoral or cellular immunity or mediators which are there. So thank you, sir.
Absolutely.
Thank you,
Wonderfully,
Anupam.
wonderful.
It also stimulates the innate immunity and also increases the interleukin 8 production. It also helps in prevention. Thank you, Anupam. Now, Sangram, what are the patient subtypes?
Sir, I'm sorry. Sir, before you go to Sangram, sir, one more fun fact that I would like to tell you.
Yeah.
That if you really weigh the non-cellular weight of the immune system, that means the weight which is given to your body by antibodies, by complement system, by chemokines, by cytokines, by TNF alphas, by interferons, by granulocyte colony stimulating factors. All these things, if you really weigh them, they will weigh around 1.2 kgs. And all these proteins are either simple proteins or glycoproteins. Now you can imagine how much protein turnover is happening. So how can you replace this much just because of, just with a simple recommended dietary allowance? So probably in a disease situation, we might as well have to go a little bit higher as far as the protein supplementation is concerned.
Except in situations. I agree. In a disease situation, the demand supply is not adequate. So there is more demand, but supply is less. So we'll have to increase the supply. Anupam, you were saying something. Come on, Anupam.
And I was just agreeing with Dr. Mangesh, sir. It is important to realize that, as you were also saying, sir, that 1.2 grams is the turnover that is required for the defense that he is saying. Apart from that, the muscles, the epithelial cells, all these linings will also be turning over. So that is the requirement, as he says, and Dr. Shilpa also said that at least 1 gram is the minimum requirement that is required. Plus, as Dr. Muruganathan, sir, you are saying that if there is a disease, then obviously this requirement shoots up a lot. So in any stress, whether it is disease, infective or non-infective, the requirement of protein does go up. And when we talk of non-communicable diseases, Dr. Mangesh and Dr. Muruganathan, sir, you are very well aware that we are talking of shifting from carbohydrate predominant to a less carbohydrate and more protein diet these days. Well, Dr. Shilpa would agree to it, I think.
Yeah. Shilpa, you want to add something?
Okay. You need to unmute yourself. You need to unmute yourself. Shilpa, you need to unmute yourself.
Sorry, I was going to add to this question, but I think after Dr. Biradkar talks about it, and then I will add on to.
Okay.
Something which I'm very, all dietitians are very passionate about.
Yes. Sangram, you tell me, what are the patient subtypes you would prefer no sugar added protein supplement? Because nowadays every company, every pharmaceutical company, nutraceutical comes with sugar free. So what are the subtypes you would prefer when no sugar added to a protein supplement?
Basically, these pre-diabetic patients nowadays, because those who have got like impaired fasting glucose or impaired glucose tolerance, which we come across in everyday practice, that is the one basic thing. And all the diabetic patients where no sugars are being used, and all the obese, morbid patients, obese patients, and the patients who are all calorie conscious patients. In all such patients, no sugars are added or proteins supplementation to be given in more form.
Okay.
So these are some of the important metabolic syndrome, obesity, diabetic, pre-diabetic, impaired, wherever there is a whole Pandora box to open, because whole diabetes is depending upon the non-pharmacological is diet, and shifting over from carbohydrates to proteins to this thing, all sort of, because Shilpa madam will be the better person to deal with all
Yeah,
these
I'll go to
diarrhea.
Shilpa. Shilpa, what is the role of micro?
Comment on
Okay,
that. I'm itching to comment on it. That's why.
okay, please,
So,
please.
so the kind of person whom you should recommend a no sugar protein supplement is one who holds Indian passport. Everybody.
Okay.
Every person who is born in this country of origin
Absolutely,
of Southeast
absolutely.
Asian with high body fat percentage at a normal BMI demands this supplement. We do not need sugar in our diets.
Absolutely, absolutely.
Okay.
Very well said, Shilpa. Very
No,
well said.
we have always have a lean type with abdominal obesity, lean abdominal obesity, especially South Asian. I think your point is well taken. Now I'll come to your question. What is the role of micronutrients, vitamins, and minerals in enhancing immunity?
So there's a huge role of micronutrients in enhancing immunity. We know that most of the micronutrients are involved in replication of the cell. I mean cell multiplication or replication of DNA, and therefore, like if you look at any kind of micronutrient like vitamin B12, vitamin D, zinc, all of these are very very important in production of immune cells turnover, because at this point there is a high turnover of immune cells and there is also high turnover of cells per se, and therefore their requirement for micronutrient goes very high. Now all kinds, all B complex, C, D, E, everything is important. One is not better than another, but what we have seen is through the pandemic we are seeing that there is a greater role of supplementing vitamin C, especially for upper respiratory tract cells. So therefore, ascorbic acid, vitamin B12, zinc, they have they have started being seen as super micronutrients. But after saying that, other micronutrients are no lesser important. And what I would like to emphasize here is most of us as Indians tend try to meet our macronutrient intake. But most of the Indians are malnourished because we never ever meet our micronutrient intake. And hence, if you cannot eat a varied diet or you have dietary restrictions, it is very, very important that micronutrients should be supplemented, especially in times of infections.
Shilpa, is there any natural way a vegetarian can have B12 and the vitamin D?
No, sir. Vegetarian B12 and vitamin D, both our richest source are from non-veg, non-vegetarian food. If you want to have B12, which is vegetarian, then you have to have a very good gut flora. And gut flora will make enough vitamin B12 for you. But there is this whole hygiene hypothesis where we are seeing that because of lot of hygiene maintained, the gut flora itself is altered, and therefore we are unable to meet our vitamin B12 requirements. And all the other dietary sources of vitamin B12 come from foods of animal origin. There is some amount of vitamin B12 in dairy products. So if you look at milk or yogurt, they will have vitamin B12. But again, our Indian habits of boiling milk not once but 150 times a day. Every time it comes out of the fridge, it is boiled, and we destroy the vitamin B12 and vitamin D3, that is even overages as added into the milk. So you have fortified milk with vitamin D, but you can't boil it the way Indians boil, 25 times a day. Then you do not have any remaining vitamin D, which is good enough for absorption.
I agree. Indian Shilpa not only boil milk frequently, they also boil oil frequently. They save the oil again, they boil it and then reuse it. Both
Sir,
of them,
in India, if it is not boiling hot, it is not food.
Yes.
Yeah. So every time, the remnant oil, the residual oil which you cook the previous day, they keep it, then again they recook with the same oil or they boil the oil again. Anyway,
That's how Shilpa loves to talk about trans fats and all that. She keeps on talking about trans fats so passionately.
Yeah. And now, Mangesh, we'll come to after all the questions, we'll have a discussion on all those things. Now, let us finish the impact of individual micronutrient supplement in boosting immunity. Mangesh?
Thank you for that question, sir. And as Shilpa has already told that micronutrients, they play a huge role in immunity. Now, as we have seen that proteins, they play a role in making your soldiers ready, but to make your soldiers fight better and better with a better armamentarium, with better response system, Probably micronutrients, they play a huge role. Now let's talk about first vitamin C. Vitamin C plays a huge role, especially in a good phagocytosis. Now we know that macrophages, macro big cells, phages, highly hungry big cells, in especially when monocytes enter the tissues, they are called as macrophages. So they are the tissues which will eat not only the offendants, but also the dead tissues, the injured cells like lymphocytes, those are injured or lost in the war, they are all been eaten away. So this phagocytosis process and the digestion process is being beautifully governed by vitamin C, and absence of vitamin C would probably sometimes sabotage this whole defense system. Along with that, it has got a terrific ability to produce antoxide effect, which per se is one of the best ways of neutralizing an offendant, especially the viruses. And higher doses are known to influence the interleukin levels by shifting or by changing the response system. Now talking about vitamin D basically is important because we all know that it gets synthesized in the skin under the presence of sunlight. But vitamin D, not much is talked about because they are responsible for stimulating the first line of defense over the skin. Under the influence of vitamin D, we synthesize a lot of, I would say, natural antimicrobial substances over the skin, which would definitely stop the invaders from invading the skin as a whole. And also, immediately below the skin, there are a layer of macrophages, which are responsible for offering the defense system. So vitamin D influences that, and also it restores the immune function of macrophages. It's very important. Even though its role in inflammation has been talked, especially when it is related to autoimmune diseases and type 1 diabetes and all that. But its role in an acute inflammation is not yet certainly proved. Its role in the chronic inflammation has been very well proved. Now coming to vitamin E as one of the most talked about vitamin, has got a big role to play in both humoral, that means that antibodies related immunity. Humoral means the immunity which is present into the fluid. So antibodies are basically the whole, I would say, key structures of humoral immunity. And antibody function improves in the presence of adequate vitamin E levels. Now, apart from that, if you talk about B complex or B6 and B12 levels, as Dr. Shilpa has already told, that B6 is very important for a cell-mediated immunity. And cell-mediated immunity in a form that B6, B12 and folate has got a role to play, as Dr. Anupam was talking about, as a better functioning of chemokines. Now, we all know chemokines are like Google Maps of the system. Chemokines will direct your immune system to reach the target site which has been offended. So chemokine function is extremely important for the protection and the better response and reaching of the army at the target site. It's very important. Also, chemokines will definitely help a better function to improve the endothelial transmission of the macrophages. So the migration of the macrophages through the endothelial linings of the capillaries. So WBCs can reach easily, and it will cause the dilatation of the capillaries. Also, the vasodilatory response, better reaching capacities are being all bestowed by all these B12, B6, folates and all that. And lastly, zinc, importantly, most important, and it's been talked about immensely, and probably zinc has been the most super celebrated microelement currently in this COVID era. Does it have really a role? Yes, of course. It has got a role in governing natural killer cells. And these are the real armamentariums of our immunity. Antigen presenting cells will catch hold of the antigen, but they will present to natural killer cells. Now, antigen presenting cell will shout that I have caught the offender, I have caught the offender. Now come and kill it. Natural killer cells and lymphocytes, especially T CD8 lymphocytes, will go there and kill it. Now, this activity, the cytotoxic activity of natural killer cells, is augmented by presence of zinc. It also improves the response of T helper cells. Now, T helper cells are responsible along with antigen presenting cells in what is called as opsonization. Opsonization means like encircling something or making it edible, like chocolate coating of something. So if you want to really present an antigen to a defense system, it needs to be coated very well with, the edible, it has to be made edible. So with zinc in the presence of CD4 helper,
You can
antigen
see,
presenting
Mangesh,
cells and
you can see
antibodies.
the slides. The
Yeah,
zinc, the role of zinc in the.
yeah, that is yeah, exactly, that is what I was talking to you about. You know, apart this is the place where probably, where you are talking about at the respiratory level. I am talking about as a whole. This is how it is. It has got a huge role to play in oxygenation, and
Network.
that's how zinc also is very important for immunity. Now selenium, magnesium, I'll not talk about it, but they all have some kind of an impact, even though its role has been not proved. But the most, I would say, discussed role currently is the role of vitamin C, vitamin D, and zinc. And I believe I have covered the necessary points on that. So what
Yeah.
do you say?
In fact, in all COVID treating centers, whether they agree on antiviral or not, all of them agree that zinc, vitamin D, and then vitamin C and B complex, invariably in all centers they give. They
Yeah,
may be differing in giving the antibiotics and antiviral, but this
correct.
they all of them agree and they give.
Absolutely,
Okay.
absolutely.
How do you assess the nutritional status of COVID-19 patients, and what are the nutritional intervention and support for critically affected COVID-19 patients? Mangesh, you can answer this because.
Thank you, sir. Again, a very, very pertinent question to current scenario, especially because we all know that muscle mass and immunity goes hand in hand, and especially muscle mass is very important. Now, it's very interesting. Shilpa, you'll be aware about this, that if somebody is bedridden for 4 days, you lose around say half a kg of muscle mass. Somebody is bedridden for around say 10 days of time, you are losing 1 kg of muscle mass. A bedridden patient more than 30 kgs technically is losing 5 kgs of muscle mass. So that's how the impact is. Just being on bedridden, or suppose somebody is on with ventilator, bedridden, all lines all here. So muscle mass loss is one of the biggest decremental factor, and there you will require a good amount of protein supplementation again. And we again come back to the same thing. And here in the slide as well, it has been very clearly said that do not stick to that typical 1 gram per kg recommended diet. The recommended diet daily allowance is for the healthy people. For the diseased people here, especially in the COVID era, where you are going to require a very, very high amount of proteins. So it can go to around up to around say 2 grams per kgs. You can really double it up. Along with this, naturally, of course, you need to supplement with micronutrients, vitamins, and look at probably, rather than a blanket therapy, probably individualize the therapy, assess as a whole, and then probably you can think about replacing the micronutrients, the vitamins, the supporting nutritional aspects also.
Anupam, from the beginning you are
Yes.
talking about cytokine storm and chemokine. So what are the nutritional intervention to control cytokine storm?
Well, thank you, sir. I think it has become very pertinent today. Dr. Mangesh has already dwelled into it, but yes, today cytokine storm was always there. But today with COVID, we understand that the deaths that are occurring and which occur in a matter of few hours to maybe a day or two, and the patient has been just stable prior to that and improving, are because of all cytokine storm. And that is how it is that the term storm gives the connotation that yes, it comes all of a sudden, and that is how it has been. Those patients who are COVID patients who are improving or just stable, and they just start deteriorating, and we cannot do anything about it. So that storm is basically cytokine mediated. So there are a number of cytokines like TNF alpha, IL-1 beta, and IL-6, which are actually promoting the reactive oxygen free species, which actually damage the primary organ being the lung, resulting in an ARDS like picture, and the typical ground glass opacity, peripheral opacity of COVID. And otherwise also, apart from the ARDS, there is multi-organ destruction which progresses, and there is a lot of cytokine damage which occurs in peripheral organs also, especially the heart, the pancreas, and even the neurological system also. So that is actually what is the problem, and that is how actually it just starts deteriorating, and there is a cascade mediated by these interleukins and TNF alpha, which actually keeps on deteriorating. And now, since it is mediated by the reactive oxygen species and these chemokines, we understand that there are triggers. So, as Dr. Mangesh was saying, and Dr. Shilpa also alluded to briefly, it is the micronutrients and the uh, proteins which are there, especially, and also the essential fatty acids, the EPA and the docosa hexaenoic DHA, hexaenoic acid. These are the agents which are there, apart from obviously vitamin C, vitamin E, which are antioxidant and actually curtail the pro-inflammatory state and reduce the oxidative damage, which can actually be helpful in limiting the cytokine storm or maybe even reversing it. So nutritional interventions will hold a lot of promise. Obviously, there are trials which are undergoing, and we have trials for anti-interleukins also. And if we have nutritional intervention which can actually mediate or prevent interleukin synthesis, then probably they will be a, I would not say that they would be the treatment for cytokine storm, but to cytokine storm, they would be a good adjunct when we give these proteins and these supplements. I think that is the way forward. Let us hope we have some adjuvants. We had some for sepsis, and similarly for cytokine storm also. I think when we actively research it, we will definitely have one or two definitely.
Yeah, as you said, it is not the treatment, but is an adjuvant for the other treatment. Very good. Thank you, Anupam. Now we'll go to Sangram. Guidelines recommendation for supplemental proteins in this pandemic. Sangram?
Unmute.
You need to unmute, sir. You need to unmute.
Yeah, basically we have to check the nutritional status of the patient, whether patient is malnourished, because so many patients we are seeing with this SARS-CoV-2, patients are malnourished. So malnourishment assessment is one of the important factor. The other being the subjects with malnutrition should undergo diet counseling, because counseling of the diet is quite important. The other factor being the supplementation with vitamins and minerals, that is also quite important. And lastly, the patient should have a regular physical activity. To assess the patient physical activity, whether patient is in quarantine or not quarantine, patient should undergo regular physical activity. So these are some of the important factors for assessment of the supplementation, mainly being the malnutrition, the other being the diet counseling, the other being the supplementation of vitamin D and vitamin C and other things, the regular physical activity. These are some of the basic parameters we should assess before we start any of the parental supplementation of the protein, because most of the patients are malnourished, or patients who are chronic infection patients or comorbid patients, diabetes, hypertension, ischemic heart disease, or HIV infections or tuberculosis. So comorbid conditions we have to see, assess their nutritional status, how they are, whether malnourished or undernourished, or they are on any of the other, as I told you, in ICU setup, whether they are on patients on ventilators or high flow nasal oxygen or parental nutrition. Those such patients where nutrition status to be checked and appropriate supplementation of the nutrition should be made. Whereas outpatient patients need not require much. Only the low socioeconomic patients, those who have got low socioeconomic, their protein nutrition, their muscle mass index is very low. Such patients should be supplemented with regular protein. Otherwise, all the chronic patients who are admitted, ICU patients, they should be assessed, and parental nutrition also will help a lot, because nutrition is one of the important, protein supplementation is one of the important. That's why in all ICU critical care setup, intravenous supplementation of like parental protein, IV albumin, these are the things which are being taken care in the ICU setup. These are some of the take homes for the guidelines in the ICU setup for chronic patients or in the outpatient patients or in regular day-to-day patients which we come across for the supplementation of protein, because minimum calorie requirement has to be calculated, assessed, and adequate supplementation of the proteins to be done. Otherwise, we are not going to achieve the goal of improvement in the COVID patients, because low immunity, low protein diet will alter in the recovery state of the COVID patients.
Thank you, Sangram. Especially this ESPEN guidelines. This is an expert statements and practical guidance for nutritional management of individuals with SARS-CoV-2. There they say oral nutritional supplements shall provide at least 400 kilocalories, including 30 gram or more proteins per day. Okay, Mangesh, your views.
Sir, I have a question to Shilpa and you also. Now here, ESPEN guidelines, they are recommending that, for mild to moderate COVID, recommend around 30 grams per day of proteins. Now, do you feel that this is really an adequate number? Honestly speaking, see, if you really calculate this will go down to half a gram per kg, sir.
Yes.
So it has to be more. And especially when you talk about mild to moderate COVID situations. Now here you are talking about people, those who can be in the ICCUs also. I believe probably we need to go a little
No,
bit more.
Mangesh, you must also never forget the person will be taking a diet also. This is in addition to the diet, oral nutritional supplements.
Oh,
It is
okay,
only
okay.
supplement. It is not
I
the
got it.
diet. It's, you are not
Okay, okay.
including diet. So when you
Okay.
calculate with diet, it will be more than what you said. So it is an
Okay.
additional
got
to
it. I got it.
the normal diet.
Okay,
Correct?
I got it. I got it. I
Basically,
got it. I got it.
Okay.
yeah,
Yeah.
patient centric approach.
Dr. Mangesh has made the point that yes, apart from diet, you require these supplements when you are in stress. If you are
Yeah.
not able to increase the diet, I think that is
Yeah.
right, Dr. Mangesh.
No,
Yeah.
Exactly. No, no, man. Yeah, Shilpa. Yeah.
so I just wanted to add, it is giving you a rough nutritional composition of the supplement use, that if you are taking a calorie of
So
400,
this.
at least 30 grams should come from protein. Others, lot of
Oh yes.
supplements have very little protein and too many calories.
Okay. Okay. Oh yeah. Yeah. That
Okay.
is.
And that
So
is
each
from the expert. That is from the
uh,
expert, Dr. Mangesh.
yeah, that's
That's
it. That's
perfectly
what we
from the
said.
expert. Yes.
See, that's why I'm happy that Anupam has agreed that I'm an expert. It is clearly said in the English. I didn't learn anything, but the English says oral nutritional supplements shall provide at least the word shall, at least 400 kilocalories per day, in which 30 grams should be protein. So that is the meaning, in addition to the diet. Okay, thanks, Mangesh. Now, what are the supplements you would recommend to healthcare professionals? See, day in, day out, you are burning out. Now, the burnout issue, the wellness of the physician, the caring of the caretaker is all now in the many journals. So we must also take some supplements because we are in a hurry. You are without family. Your family is somewhere, and you are in the COVID hospital. You don't have time to eat food. So, what are the health supplements you will give to the healthcare
Yeah.
professional?
It's $1 million question, sir. Honestly speaking, and we all need probably to discuss about this little bit better. I believe in most possible practical way. But I would say rather than simple nutrition, I think we need to really look it as a whole lifestyle aspect of the whole thing, rather than just talking about nutrition. That basically eating a healthy now. At least COVID has taught us a couple of things. One of the most important things that we all can survive on the home food fairly fine. You don't have to order anything from outside, and still your wife or or a sister or whoever is cooking the food, or you yourself can cook a food which can be absolutely very lovely and one of the delicious foods that even children have forgotten this. So probably same way healthcare professionals should probably have a really healthy lifestyle. I believe they have to have the diet which is of a right proportion, but then do not forget on an adequate inclusion of fresh fruits, or at least minimum 4 servings of fresh fruits, or 4 to 5 servings of vegetables which are fresh. you know must exercise during the time. De-stressing is very very important. Apart from that, reduction of as you already talked about and we all have discussed about, reduction of junk food, or I would say fast food, and most importantly is a good amount of sleep. Around 6 to 8 hours of sleep would definitely help all the healthcare professionals to. And as far as supplements are concerned, I believe I would like to still hear from Dr. Shilpa on that, because
Okay,
this is
now
one
we'll
million dollar
go to
question.
the panel discussion. Again, a lot of questions have come in the box, but before that, let me also give you additional points after the panel discussion is over. Now, can you send me all the questions to me? The organizers, please send the questions to me. The chat box questions.
So, yes, sir.
Thank you, Muruganathan sir. That was wonderfully conducted. It was
No,
superbly conducted.
we have more questions. Then only I'll come
Yeah,
to
yeah.
you later. Okay. There is a question from the audience, Navneet Kumar from New Delhi. Any synthetic micronutrients nutrients as good as natural? Shilpa, you think the synthetic micronutrient is as good as natural?
So that means nutrients in supplemental form versus those coming from food. See,
Yes.
there is no competition between food and supplements which are manufactured. It's chalk and cheese. You can't compare. But in situations like today, where when we were in the helm of COVID pandemic, even we were not getting our basic necessities like vegetables and fruits, and that time to maintain immunity, we really need to take supplements which are commercially prepared. But after saying that, natural supplements coming from natural sources are the best.
Yeah, actually, even the supplements, there are very many supplements. You should be very careful when you buy a supplement. You must see the food label, because there's false and fake supplements are there. But there are really good supplements which are approved by all our many agencies. So I think you will have to look for it. But again, something is better than nothing. When you can't do anything, at least that supplement will be happy. Because when you cannot take B1, B6, B12, you can have one capsule containing all the vitamins. Swallow one tablet. It's no harm. Even the other international journals agree with that. But you cannot do that. Yes, Silpa.
But it is not a substitute for eating healthy.
No, that's what I'm saying. When you eat healthy, also something is better than nothing. And when you can, say, for example, a vegetarian who cannot have B12 and he has no access for any good food, at least that combining all the vitamins we do, because all of us in day out, we give that because, many people's RDA is not there. So to supplement the RDA, we are giving in a capsule form. No harm. That's what I said. Mangesh, you were saying something. Mangesh?
No, that absolutely fine. In fact, I agree to what more than agree to what Dr. Shilpa is saying, and I completely say that because it's not just the composition which matters, but the structural association with various other things which are usually seen of these micronutrients in the natural food will serve definitely a different functional abilities than probably what is there in the synthetic or probably naturally or artificially synthesized food supplements.
Even when you go for artificial supplements, you should see the label and you should see the quality, because there are lot of fake things are coming. They price it so heavily, and people think the costly thing is very rich and very nutritious.
Absolutely.
See, instead of a big vitamin C, if you take one amla is good enough for any number of vitamins. So amla, you cannot match amla with any supplement, and you cannot take vitamin C as a tablet when you have a natural fruits. So there is no comparison. But when you don't have any option, this is only supplement. The word itself is supplement. It is not the main. It's only supplement. I think Shankar, Anupam, one of your friend Shankar Shahai, I don't know. He's very particular that you only should answer this question. I don't know. So you answer the question. In the present work from home scenario, when the pressure of official and personal work has increased tremendously, as a doctor, what you would advise people to maintain work-life balance? You are a philosopher, I think.
He is Anupam's friend and he is also Anupam's resident, I believe.
Anupam?
Sir, the best person to answer is Dr. Shilpa, the most competent of all of us. But anyhow, I would just deal into it. And Dr. Mangesh has already partially answered it, that to strike a work-life balance definitely for anybody today is very difficult. Number one, the work is not secure. So the stress is very high. Many people have lost wages and people are sitting at home. They are not sure when they will get. I have seen many of our health workers, our previous patients also. So that is not only the work, but insecurity, stress which is there. So for that, what Dr. Mangesh said, it is very important. Number one thing is that we should continue to eat healthy and de-stress. De-stress is very important because not only by having some of our hobbies that we can have, especially when we are indoors and confined to home. But yes, apart from that, meditation helps. Then a good night's sleep, that 8 hour sleep that Dr. Mangesh said is very important. And even if you don't get sleep, if you are lying in bed, despite you are awake, then also it is a valuable rest that the body gets. At least the physical rest is there. So physical as well as mental rest, and trying to see that yes, every cloud has a silver lining, so this cloud will also pass on. It is only a matter of time. So that positivity has to be there. And Dr. Sangram, Dr. Mangesh, Dr. Shilpa, and sir, you yourself have actually put it that yes, things would be better off sooner than later. And till that time, if you can afford these supplements, you can add them to your diet, but not without diet. I would also stress with the fact that yes, diet is the most important thing. And obviously, we have been asking home deliveries, but as Dr. Mangesh said, it is better to prepare at home rather than going for home deliveries and trying to get some information.
Anupam, thank you for your answer. But the question is not only food. is saying work and life balance. It is a philosophical question because today is a World Mental Health Day. World Mental Health Day. So it is a philosophy of life. Whatever you said is okay, but the work-life balance. How do you balance your work and life? So that is what
Not like
the
life.
question is.
Sir, you are the best person to answer this work-life balance.
Yeah, that's why.
Because
So
you are doing it,
today
sir.
is a,
You are doing it yourself. So
yeah, today is a World Mental Health Day. You see, you have already answered few of them. You know, you should leave the work in the workplace. You should not bring the work to the house. Same way, the house things you should not take it to the workplace. Then you should definitely will have problem. Suppose you are a surgeon. If you have a problem with your house and if you come and operate, you will not operate well. So you leave the house worries there. And if the patient is not passing urine and you are worried, you come to the house with the patient is not passing the urine, you will be angry with the family. So you should leave the work in the workplace and the house place, and you should always try to balance your work and life, and you should not overstrain. And especially in our Indian doctors, we are burning out. Every Indian doctor, as for example, Mangesh Tivaskar, morning to evening, night, he sees so many patients. He doesn't have time for his children. He doesn't. When he goes home, the children already slept. And before they wake up, he comes out of the house, and come to the clinic. So don't do that. My advice to all of you: spend some time with your family, and that will give you immunity for you. When you are with your family, your immunity is good. At least one food you should take with the family in the dining table. That is nothing. That is the most important thing which you should do every day. Okay, coming to Mangesh. You said 8 servings of food, vegetables and fruits. What do you mean by one serving?
that probably you should ask Dr. Shilpa, because she does it all the day. You ask her in the sleep also, and she will say, what is a serving? So let us listen from Shilpa
Mangesh,
on that.
I purposely asked because this Navneet Kumar, I don't know. He says, Mangesh Tivaskar, you please answer. He said like, okay,
So,
Shilpa, please.
I know that, but Dr. Navneet,
Okay.
I am sorry, I am not an expert on that. Let us hear from Dr. Shilpa.
Yeah, Shilpa, please.
So a serving of fruit is the amount of fruit that gives 10 grams of available carbohydrate. So typically it is around 50 grams of fruit that gives you about 10 grams of carbohydrate. So if you actually take an apple, a medium-sized apple, it's 2 servings of fruit.
Okay.
That's the definition of a serving. 10 grams of carbohydrate is 1 serving.
That is wonderful.
Okay. Suppose, you said 10 grams of carbohydrate is 1 serving. And if to get 10 grams of serving, you have to have 50 grams of fruits, right?
Yes.
So
1 serving is 50 grams roughly.
50 grams of fruits means, my question is, the DASH diet says, that is dietary approach to stop hypertension, says, 3 to 4 servings of fruits and vegetables. That means 200 grams.
Pardon? That means 2 fruits a day.
Yeah, that means, according to you, 50 grams gives 10 grams carbohydrate. So 4 servings.
Sir. No, sir, it's not like that. For example, mango 20 grams gives 10 grams of carbohydrate. So I am talking in general. Guava 80 grams gives 10 grams of carbohydrate. So in general, what we say as a thumb rule, eat 2 fruits a day and 3 to 4 vegetables a day, and you will meet your requirements. So 2 cooked vegetables, 2 raw vegetables, and 2 fruits. Very simple.
Yeah, because this is the question, because I am a hypertension man. Whenever I say 4 servings of food for the DASH diet, tell me what is 4 servings. So 4 servings in the fruits means 2 fruits, 4 vegetables. 4 vegetables?
Yes.
2 cooked form, 2 uncooked
4
form.
vegetables, out of which 2 raw and 2 cooked. Very simple.
Okay. If antioxidant must be received from natural sources than fruits and vegetables, only can provide antioxidants from phytonutrients, then how many fruits and vegetables per day are needed? Phytonutrients.
Can I? It's for me.
For your forte. Yes.
So phytonutrients are not only present in fruits and vegetables. We see phytonutrients in seeds. We see phytonutrients in nuts, and therefore it has to be a varied diet. Like I said, 2 fruits, 3 to 4, or even 5 vegetables, because vegetables are much lower in calories and more in micronutrients. So you can increase the servings of vegetable. And when I say that, I want to specify potato is not a vegetable. It is a cereal. So मैंने आलू की सब्जी खाई बोल के I ate a sabzi does not work. So green leafy or other vegetables. Have a handful of nuts every day. And very, very important in today's scenario, September 29th was World Heart Day. So 1 tablespoon of seeds every day. Seeds give us arginine. Arginine is precursor for nitric oxide, which is an endothelium relaxing factor. So we need, and with COVID, we are so stressed. I mean, this is something that we need. We need to even relax internally, and therefore, eating a teaspoon of seeds, and seeds are all kinds: pumpkin, sunflower, flax, chia, sesame, name it. Eat them every single day, and you will get a lot of phytonutrients from that.
Yeah, I always say my Tarak mantra is nuts nurture the heart. Nuts nurture the heart. So that is my Tarak mantra for heart.
I'm writing it down.
Yeah. Anupam, there is a belief that COVID is just like any other virus and the fear about is overemphasis. Can you please say something to dispel this myth?
Sir, COVID is, yes, sir, I have heard it. Sir, people are asking me questions to which there are no answers. But anyway, whatever evidence is there, I will try to answer. COVID, yes, coronavirus, this novel coronavirus is like any other virus in the sense that it is an RNA virus and we know some things about it. But how it is also like any other virus, like other viral infections, 90% of these are usually asymptomatic or don't require much attention. But yes, it is different also because those who get it, those who have moderate to severe infection, those who get admitted, those who require oxygen, those patients can have really severe debility, and even these moderate to severe patients have a long lasting maybe malaise, lethargy, asthenia, and a whole lot of body aches, etc., which can persist for a variable time. Ordinary viral infections can cause up to 1 to 3 weeks. It can last, we have seen that it can last from even 4 to 8 weeks, and despite that period people are still not normal. It can cause a damage to the lungs which has yet not been seen with any other viral infection, not even with influenza and any other viral infection, I would say. So it is different. The magnanimity of disease that has been seen with COVID has not been seen with any other viral infections, even with HIV. But that is, yes, I would not say that everybody should be alarmed. We should take precautions. That is seen in less than 5% of the cases, and most of them are recovering, and the mortality rate has been low. That is one plus point. But yes, COVID is not an ordinary virus. We should be very careful when we deal with COVID. And COVID virus, I would say, I don't remember of any other virus which has caused more debility. Mortality maybe yes, but more debility in the short run has been seen with COVID only, I would say. So it is not true to say that COVID is just any other virus. We need to be careful, and we are having a lot of post-COVID sequelae. Dr. Mangesh and Dr. Milind Natkar are actually publishing articles every month. He has written an editorial also, Dr. Mangesh. So it is a very serious illness, I would say, for those who get hospitalized. So many get discharged, but still 5% I would say still need, there is new onset diabetes, all those things. So it is not an ordinary virus, which I would say.
No, it is like this, it is not terrifying to make people to understand, to go for precautions. If we say smoking kills, that means, the amount of smoke when you do, you have got a lot of problems. So you take a precaution. Same way, you should always take precautions of hand washing, masking, physical distancing. Only if you repeatedly say, you be careful, just to, it's not terrifying, just to make them understand to follow precautions. That is why, again, this is there. It's good. Mangesh, your view, whatever Anupam said about the scary.
No, I completely say that I completely agree with Dr. Anupam, and he has very rightly put it as that it's not a routine regular viral infection that we are dealing with. It is certainly different, even though we still don't know a lot of things about this virus. We are learning every day. The science is changing every day, but there are 2 or 3 things which are very, very clear. Number one is this, that even being like a regular influenza virus, but this is more infective, can cause really a serious life-threatening pulmonary damage, and can lead to some problems. Now the challenge is this, that there are no golden rules to decide that who will not get and who will get the complications. There are no parameters to decide. We do not know anything about that yet currently. So, as a whole, rather than being scared, the smartest thing to do is please follow the instructions which have been issued by the authorities and do not challenge them till the time we do have an answer for all the questions that has been raised. See, India is the only country which has been hit in our all entire South Asian Pacific region. We have got 5 neighboring countries together. None of them have been affected. Similar class of people staying there, same race, same amount of problems that they exist in our neighboring countries as well. But they did manage it well in comparison to India. So something which has not been right for our country, and we need to understand. And unless and until people take their own individual responsibilities, the things are going to be really tough for us. So do not underestimate the power of corona. Deal with it, learn, be smart, and learn to live with it, following the ethics of the game. You need to follow the ethics of the disease. Respect it, follow the rules.
Yeah, now I'll come to Shilpa. Shilpa, tell me a few tips. What is the role of Tulsi? What is the role of curcumin? And what are the natural immune boosters? Tulsi, curcumin, they say so many chavas or something in the diet.
Sir, I thought you would be considerate to Dr. Shilpa. You have also asked her a tough question. This is not right.
Dr. Anupam.
See, Anupam, for this particular question, she is the most authoritative person to talk all this, because she's a dietitian.
She is the most authoritative for all the questions because she is the only competent person. We are just telling our experience.
Okay, please. Yeah, Shilpa.
No, so again, when you talk about curcumin and all, these are all impactful spices and their bioactive principles, which are very, very important in immunity. What we have seen through the COVID pandemic is the bioactive principles of turmeric, that is curcumin, for pepper, that is pepperin, and from cinnamon, that is cinnamic acid. These are all shown to have improved immunity, modulate immune response. So these are the nutrients, but again, their dosing is not something that we know. How much? We do not know. So regular consumption is what it is advised. So whether it is Tulsi, which is advised by Ayush Ministry, so that is again something that, again, dosing, how much should you consume? We do not know. As long as you consume some every day, this is going to have a long lasting effect. And there have been so many webinars and so many times questions are asked that if we do all this, is it that we are going to get immunity? So immunity does not come in one day. So, it is not like you eat Tulsi today or you have Haldi today and tomorrow you are ready to go without a mask. So basic precautions exist, but yes, these bioactive principles do help you to keep your immunity sharp or good. That's
correct.
Sir, curcumin, if I can add, is one of the greatest modulators of 5-AMP-K, which is really a cell switch determining the cellular metabolism and cellular homeostasis. So, 5-AMP-K pathway has been one of the most potent ways of cell metabolism, switch off and switch on system that a cell has. So, curcumin plays a big role in regulating this. The curcumin has a point. Yes.
I also wanted to add one thing. When we talk about curcumin, all Indians say, "To kya? No, खाने में तो रोज हल्दी होता है." So remember, that does not work. If you want to take curcumin, you want to avail the medical benefits of curcumin, then you have to take haldi by itself. So don't count haldi in your dal and your sabzi as curcumin intake, because it is mixed with 150 things, subjected to very, very high temperature of cooking. So try to consume it as such or as advised. So that's very, very important.
What about ginger?
Mint and turmeric together are shown to be a very, very good combination. So turmeric milk, turmeric latte as it is called nowadays. It's a very good combination for bioavailability of curcumin.
And they add ginger also. Ginger, turmeric, curcumin, everything. They put that, and then they also make a good milk and good juice. And they say it is immune booster juice. Okay, I think it's time up now. I'll go one by one. You give your drive home message. Then I will give you concluding remarks. So let us start with Sangram. What is your message for our audience about the immunity and the COVID and infection overall?
The so overall thing is that every patient is aware that whoever is getting a disease, they have got a low immunity. So nowadays we are seeing so many patients who are coming and asking us, you check our immunity. Am I going to get COVID or not? So this is how the patients are coming. So basically they are under a myth that low immunity. This is not the only factor which is playing a role in COVID era. Low immunity is one of the important factor apart from other measures like wearing the mask, physical distancing, hand washing and all. They are all the important things. Another thing is we are seeing a lot of patients coming with hypervitaminosis. Like patients are taking vitamin D from the past 6 months from lockdown onwards, vitamin C from past 6-8 months, zinc from 6-8 months. So now on estimations we are getting a lot of hypervitaminosis. So because somehow they want to escape from the disease. So they are thinking that these drugs are going to prevent them. These drugs are not going to definitely prevent. They only build up for immunity, but they should be used judiciously, cautiously.
Thank you, Sangram. Now I'll go to Anupam. Anupam, your drive home message from your side.
Sir, I would say maintain good nutrition, eat a regular diet and timely diet, and then continue with your exercises and a good night's sleep. That is very important. A good night's sleep is very important to rejuvenate your immune system and to relieve yourself of all physical and mental stress. So that is one very important thing. And obviously, if you can take supplements, that is well and good. And as Dr. Sangram said, don't do excess of the supplements. Yes, but diet is very important.
Okay. Now, Dr. Mangesh, your words of wisdom.
Yeah, I completely agree to what Dr. Anupam says. That sleep well, because the best possible garage to maintain your entire days or your systems overhauling or reservicing, which has to be done. The best garage is your bed, and do not take your stress to the bed. I don't mean that you should not sleep with your wife, but then don't take your any kind of stress to your bed. Have a very good night and very healthy sleep. That is one of the best things that you can have to boost up your immunity.
Thank you, Mangesh. Now, Shilpa.
Okay, so I want to just say that food is indeed a medicine, but medicines have a dose. So food should have dosage. Just because you're sitting home and kitchen is next to you, please don't visit there every 5 minutes and find food to eat. Because we are seeing people gaining weight. We are seeing diabetes and blood pressures going out of control because of stress, but because of also wrong eating. So yes, Hippocrates said food is medicine, but medicines have dosage.
Especially the food medicine should not be taken in front of television.
Beautiful.
Yeah. So let me give my concluding remarks. So immune boosting tips, stress management is very, very important. Stress is one of the prime reasons for weakening of the immune system. Stress reduction techniques like yoga, meditation, tai chi or whatever to maintain the immune system is good. So no stress. Number 2, workouts. Exercise definitely increases circulation and helps regulate the immune system and hormones that influence the healing process. Third is water for better immune. Drinking plenty of water flushes the toxins, ensures that your cells get all of the oxygen they need to function as they were meant to. Fourth one, meditation, mindfulness. Please, have this word mindfulness for everything. You should have mindfulness in the eating also. We don't know what we eat in the morning. See, all of us doctors, when we eat, we don't know what we are eating. We are eating idli, dosa, chutney. We are in a hurry to finish the breakfast and go to the hospital. So you must eat mindfully. Mindfulness is the basic human ability to be fully present, aware of where we are and what we are doing, and not overly reactive or overwhelmed by what's going on around us. So meditation reduces inflammation, enhances our immune functions. It also helps us to focus our attention and feel less controlled by thoughts or feelings that seem challenging. So meditation. Other mantra is focus on holistic wellness. No unhealthy food. Avoid junk foods. As I said, fast food takes you faster to the grave. Dairy, maida, non-vegetarian, deep fried, packaged food, trans fats as much as possible. Avoid those. Practice gratitude and love. Just as Sanitizers and masks work as shields on the outside. Your healthy thoughts and immunity are your inner shields. Every moment, thank God for being safe, strong, and healthy. Just like we can spread a disease, we can also spread love and gratitude. So focus on holistic wellness. Laughter and connection. It is so important to have some light relief now more than ever. Watch a comedy on a TV, listen to a funny podcast, or listen to jokes from Mangesh Tivaskar and Anupam or Shilpa. Book or read a book, a humor book. Make sure you connect with your friends and family on a daily basis to ensure you don't feel isolated. A belly laugh increases the ability of your immune system to fight infections. The cells in your body react to everything that your mind says. Negativity brings down your immune system. And ways to boost our healthy bodies naturally regenerate cells and tissues within this system. Harvard Medical School has several suggestions for keeping healthy so our bodies can continue this process. One is don't smoke, mindful eating. Eat a diet high in fruits, vegetables, and whole grains and low in saturated fat. Exercise regularly. Maintain a healthy weight. Control your blood pressure. If you drink, don't drink alcohol. That is not moderation also. Get adequate sleep. Take steps to avoid infection, such as washing your hands frequently and cooking meats thoroughly. Get regular medical screening tests for people in your age group and risk category. Eat less, chew more. Sit less, walk more. Hate less, love more. Fear less, hope more. Whine less, breathe more. Talk less, say more. Follow women. I say follow women means W is wash your hands, observe physical distancing, masking, eat healthy exercise, eat healthy food, do exercise, no travel, not to touch nose, and always say namaste, no handshake. So this is the Taraka mantra now at this time. Follow women is the mantra. And one more thing, whenever you do any good service, your immunity increases, your antibody, endorphin increases. So please help somebody. Even if you don't help somebody, if you watch a television where somebody, some nurse or some doctors are serving the community, by watching the service of others, your immunity boosts up. There is a paper saying this. So I am telling you, I am requesting all of you, laugh well, help others, do service. Even if you don't do service, watch doctors and nurses doing service, appreciate them, your immunity will go up. So ladies and gentlemen, with this, I think I have to wind up, and I thank all the panelists who have done extremely good work. Dr. Mangesh Tivaskar, Dr. Sangram Bradar, Dr. Anupam Prakash, Dr. Shilpa Joshi, all of them gave a lot of inputs, and even now there are so many questions are unanswered. If you can pass the questions to us, we will individually answer you. And my message, clearly I've told you, be calm, take care of others also. When you are safe only, others you have to help them. In the airport, in the flight, they say, before putting the oxygen, you take the oxygen and give the oxygen to your children. Same way, you take care of yourself before you taking care of others. You are not safe unless everyone is safe. That is the message. Please follow women, and thank you for your attention. I thank the McLeods for supporting this through the unrestricted educational grant. I also thank the exchange webinar people who has promoted this wonderful and interesting webinar. Thank you all the participants. Thank you very much. Take care. Good night. World Mental Health Day. Be happy, be cool, be calm. Namaste. Good night.
Namaste.
Thank you,
Good night, sir. Good night. Good night, Shilpa. Good night, Anupam. Good night, Dr. Sangram. Good night, sir.
Right, so thank
Bye-bye.
you.
Thank you.
Good night,
Thank you,
entire team McLeods. Good night. Bye-bye.
Gandhi sir. Thank you.
Thank you.
Okay, thank you.
Thank you, sir.
So yeah,
Thank you, Meenakshi.
myself Ravi Modi, Senior General Manager with this company. I take great pleasure to thank you for your active participation and unlocking immunity in a real platform. So unlocking immunity is something which we are discussing since so many months when the COVID era has started. After post-COVID era, we'll continue to discuss on this unlocking immunity. But the way you have presented, Dr. Muruganathan, the way you have moderated the session is wonderful, and it's excellent, and it's wonderful and enlightened unlocking of immunity in a real term. Not only the exercise, not only the mental health, not only the foods, not only the exercise. What you have told us, you cannot buy the health. That you have to take health from your foods and you have to take health from your supplementations. So, and thank you for the balanced view from the Dr. Sangram, giving the views on the recommendations and also giving the views on the post-COVID era and COVID era maintenance, how to maintain the COVID. And Dr. Anupam Prakash well explained, and Dr. Shilpa Joshi has given a way light to the different recommendations and the food what we can take. And it was an interesting presentation. And also I present Dr. Mangesh for making it very interesting at times, giving the facts, interesting facts about the cytokines, about the interleukins. So altogether, it was a wonderful to have you all as a panelist for this unlocking of immunity. So in future also, we'll expect your guidance and expect your views on this COVID-19 and post-COVID-19 maintenance. So in the last, what the message I have got from all of you is to be happy on this World Mental Health Day. It happens to be a good to present our immunity. So immunity is built with the all put together along with the supplementation. All put together gives you unlocking of immunity, which is very, very important at this stage. Thank you, doctors, and thank you on behalf of MacLeod's, the Ostiva, which looks after mainly to the gynec, ortho, and physician segments very well. Thank you, doctors.
Thank you. Thank you.
Thank you.
Thank you,
Thank
Anupam.
you all, doctor.
Thank you, Sagram.
Thank you.
Thank you.
Thank you, sir.
again.
Thank you.